Today I'm going to talk about aerobic exercise. Aerobic actually means with oxygen, which can give you a clue as to the level of intensity that you should be working at. Now, aerobic exercise is actually any type of cardiovascular conditioning. What are the benefits of aerobic exercise? It improves our cardiovascular conditioning, decreases the risk of heart disease, lowers our blood pressure. It can increase our HDL, which is like our good cholesterol, helps to control our blood sugars, will assist in weight management or weight loss, improves lung function, and also decreases our resting heart rate. The level you work at will depend on your current health situation and level of fitness. Aerobic exercise can be divided into low impact aerobics and high impact aerobics. So some examples of low impact aerobics would be going for a brisk walk in your neighborhood, going for a bike ride, going for a jog in your neighborhood, or even swimming once they've reopened some of the swimming pools if you have access to one. High impact aerobics exercise would include running, skipping, jump rope, or some high impact aerobics or step classes. How often should I be doing these exercises? You should be doing a minimum of 30 minutes of cardiovascular exercise 5 to 7 days a week. This can be broken up into shorter 10-minute time periods. One way to do this is to go for brisk walks after every meal. Not only will this help to get your daily amount of cardiovascular exercise done, but also it will assist in reducing your risk of cardiovascular disease, diabetes, hypertension, and high cholesterol. You will also burn the same amount of calories as you would if you had walked the full 30 minutes at one time. You can do aerobic exercise every day. It's going to be very good for you. There is no need to rest in between sessions unless you're at an extreme level of training, such as preparing for a marathon, or if you experience recurring joint pain. If joint pain is an issue, it would be a good idea to alternate less painful exercises with those that may cause joint pain, or just discontinue the painful exercises altogether. How do I know if I'm working at the right intensity? I like to use the RPE, or rate of perceived exertion chart, to help determine the correct level of intensity for my client. The scale uses a 1 to 10 rating system. 1 is very light, such as getting up and walking to the kitchen to get a glass of water. 10 would represent maximal exercise at a very tough level. I wouldn't recommend anyone to work at a 10 without strict supervision by their healthcare provider. We're looking for a moderate intensity, and that would place you between a 3 and a 5 on the RPE scale. How can I progress? Sometimes you feel like you are not really pushing yourself hard enough, perhaps. Progression to higher levels of exercise should be based on your individual exercise tolerance. There are 3 methods for challenging aerobic fitness. 1, increase the speed. 2, increase the resistance. 3, increase the duration. Any of these methods, or a combination of these methods, will improve your aerobic fitness. Increasing intensity should be done very gradually. You should challenge yourself only for a few minutes at a time. So don't get too over-enthusiastic and end up making yourself feel unwell or even getting injured.